India's healthcare system is plagued by two critical challenges: acute scarcity of medical practitioners and poor access to primary healthcare. India has one doctor for every 1500 Indians, as against the WHO recommended norm of one for every 1000. With 60% hospitals and 80% doctors located in urban areas, about 3/4 of the country is still underserved. Making healthcare accessible requires a systems approach that can leverage the existing infrastructure with new technology and inventions. In this episode, we take a look at a health tech innovation that is inventing for impact at scale.
Diagnosis is just like justice, right? When it's delayed, it's denied. Late diagnosis and misdiagnosis is a massive reality for literally hundreds of thousands of people every year. And the right specialist may not be available at the right time. I think that the only way to bridge this gap is using technology. FiveC Network is India's AI-powered radiology department. What we're doing is broadly three things. We are the system of record for radiology in India, and we have also built India's most advanced and most reliable network of specialist radiologists. And we're using the data that we've collected and our technology in order to build a platform. Hospitals and diagnostic centers across India can not only get access to the best specialists, but also the cutting edge or bleeding edge technology like the latest AI. There was a case from Shimoga, a diagnostic center from Shimoga that came in. And the moment it came in, our AI actually diagnosed it as a bleed in the brain, which is a critical case. This was flagged to one of our radiologists who reported the case in 9 minutes. And this information was conveyed to all stakeholders. The patient was immediately taken to the hospital where the surgeon who had to perform the surgery was already ready with the information through our platform. And the door to needle time for that patient was pretty much zero. This life was saved, and it's something that we do often, and it's something that we take a lot of pride in. There are going to be over 50,000 new radiology machines in the next 5 years. And India has now just about 11,000 radiologists, 75% of whom are in your tier 1 cities. So who's going to serve the massive population across the country?
To answer that question, today FiveC reads cases for more than 100,000 patients across 25 states in India every month. An example of how social innovation can move the needle on the three most important parts of healthcare: reduce cost, raise quality, and improve access. This is just one of the many such innovations we at Wilgrow take pride in nurturing. The world needs more such innovations, ones that are sustainable, scalable, and answer pressing community needs. Whether that's adapting to climate change or providing communities with access to water and primary healthcare, this is where the poor, the under-resourced, and the underprivileged can take part in building a sustainable future. And the future of social innovation starts with inventing right, inventing for impact.